I think it's an opportunity. It's the first time we are convening as Rotarians in Akili. So when we were calling for this meeting, the DG said, "Get me all the Rotarians." I said, "But everybody looks like one." We thought we would be quick on time and be ready for inauguration as a corporate club when they turn Rotary.
Okay. So if we've done that, I think the other aspect which rallying call for the Rotarians who are from the Ministry of Health. We are putting that even a medical officer or just a general surgeon can be capacitated to be able to handle some cases which do not necessarily need of the work. But I'm sure progressively over years until the that means that they're going outside Kampala. And all the other aspects now, when it comes like that, then we
that it is something.
I think he is highlighted.
Scope this one, scope it in such a way that it's much bigger than the honoraries, coming in and doing a camp and going away. Maybe one more comment, because with Daniel was
3 operating rooms. But that said, if we have burns in the mix, the numbers count. But the pallet, we can do it about 2 hours. The lip is much shorter than that.
Experience in the past few camps, how many numbers were you looking at? We have a certain
organized camps. We need now to begin to think how we scale, to other regions. Probably there is maybe at some point you will be able to have teams that can be able to put together something that can be discussed between the two teams to see what is possible within probably a period of, I don't know whether 3, I think they work in 3s. I saw a plan of 3 years, maybe 3 years. You see what is practical and possible within these 3 years and how we can be able to scale this.
We're screened, and that's pre-clinic and then also walk-ins. The majority of them were burn patients. Only about 4 or 5 lip and palate patients were seen. So the bulk of the patients were burned. Do you guys do you have anything to add? Yes.
No, and a lot of those cases were two different things that we were doing. So there was 2 operations going on at the same time. So you don't get nearly as many surgery, as many patients through in that case.
And then you can have this bigger one, and then while during the processes, the other teams can continue doing what they continue doing, and then you have only bigger cases which are kept in for one major operation.
Dr. Miriam Ajambo, nkola n'ekitongole Ministry of Health of Uganda, nga ndi musawo w'abaana omutendeke, nkola wano nga Principal Medical Officer. Kati abaana 1,000 ku baana bonna be tubeera nabo mu ggwanga, abaana 1,000 buli mwaka bazaalibwa nga balina obulemu buno, cleft lip ne cleft palate. Kati abaana 1,000 oyinza okulaba nti batono si batono bangi. Kati tumanyi nti gye bali eyo mu byalo. Mwenga bannamawulire mubuulire abantu babeere nga batuweereza ebifa ku baana bano bajje balongosebwe. N'abantu abakulu bwe bajje bali naye abasinga baba baana. Abasawo abasobola okukola tuyita plastic surgery, kuba eno plastic surgery si kulongosa kuno okulala okwa general. Abasobola okukola plastic surgery bakyali batono, omuwendo teguwera na 5. Kati tulina okuba nga tutraininga nga tusomesa abasawo ne bakuguke mu kukola plastic surgery oba okulongoosa kuno okuzaawo omuntu n'alabika bulungi. Tuli mu ekirudu ne Makerere tuli mu kusomesa kale basomesa, naye tetunaba kutuuka ku muwendo guli ogulina okubeera nti guyamba eggwanga bulungi. Kati tukyetaaga okutraininga abasawo bano abakola plastic surgery. kakati ekikulu nti abaana bano abaliko obulemu abazadde abasinga babakweka mu mayumba, abamu bafiira n'eyo nga babaleka eyo. Kati abamu tetubafuna na mu balwaliro, naye bwe baba batuuse mu ddwaliro era babasindika ekirudu eddwaliro lyaffe ddene erirongoosa erikola plastic surgery, naye abasinga bambi tebatuuka mu ddwaliro kuba oli omuzadde aba atya omugjayo mu nnyumba. Naye nkimanyi nti gye bali eyo kati era tulina okubeera nti tufuba nnyo tufune ne senta eyo mu byalo oba mu regions nga bwe tulina amalwaliro gaffe mu regions n'okulongoosa kuno okubeera nti tulongoosa abaana baliko obulemu kituuke eyo mu byalo oba mu regions zaffe abazadde we basobola okutuuka amangu. Kati omuzadde bwe bamusindika okuba eggulu okujja eno ekirudu ne sente zimuleeta ayinza obutazifuna, ekyo nakyo ne kimulemesa okufuna service. Naye bw'aba nti wali eggulu ku regional referral oba kumpi awo waliwo abalongoosa buno obulemu abasobola okutuukawo mangu ne balongoosa omwana. Kati okuba nti eggwanga lisomesa bano aba plastic surgeon tekimaze ebbanga ddene nnyo, kyova olaba nti tukyayinayokko emyaka katugambe kale nga 5 mu 10 awo. Tetusobola gamba nti tujja kikola mwaka gujja kuba tukyali ku senta yaffe eno ennene tufune abasawo abagimala then bo babeere nga bagenda mu regions zino ba training be basobola okutraininga oba nabo bajje eno baba training baddeyo eri. Kati kijja kutwalako ebbanga mu myaka 5 mu 10. Abazadde bambi omwana talina musango. Katonda bw'atyo bwe yasiima n'akuwa omwana ng'ali bw'atyo, naye yatuwa n'amagezi agasobola okuzzaawo omwana oyo. Tuyina abakugu abasobola okulongoosa omwana oyo n'addawo n'abeera nga alabika bulungi nga mwana eyeeyagaza. Kati tusaba nti toleka mwana wo kufiira mu nju, toleka mwana wo kubeera nti tasobola na kugenda mu banne kusoma. Muleete bamulongoose ekirudu omwezi ogw'omukaaga, naye ate tolinda mwezi gwa mukaaga kuba kati tuli mu kuregisteringa. Tugenda kubeera nga tuwa bana ab'amawulire akalinki k'osobola okukozesa n'obeera ng'osindika ebifa ku mwana oyo. Fene tukukubira n'obeera ng'oleeta omwana ne bamulongoosa. Leka mwana tumuleka kukunziba kufiira mu nju. Kakati kampu eno gye tutegese egenda kubeera mu mwezi ogw'omukaaga Kirudu National Referral Hospital ng'egenda tuyambako okuba nti tulongoosa abaana abazaalibwa n'obulemu ku feesi, nga bazaalibwa n'obulemu nga omumwa tegwakolebwa bulungi oba muli munda mu kamwa ng'olabamu nti mulimu obulemu, ze tuyita cleft lip ne cleft palate. Naye n'abajja amazzi ng'emikono kati gikyagolola bulungi oba ebigere, nabo bagenda kuba nga bayambibwa. Tufunye omukisa nti waliwo basajoni abagenda okuva mu gyetuyise Rotaplast International nga bakolagana n'abasawo baffe abaawano abali ekirudu nti be bagenda okuba nti balongoosa abaana bano. Kakati lwaki tulongoosa abaana bano? Kale n'abantu abakulu naye abasinga babeera baana. Bano abaana bwe baba bazaaliddwa nga omumwa tegwakolebwa bulungi muli ng'akyali mu lubuto lwa maama we, n'azaalibwa ng'oba n'olulimi luliko obuzibu oba muli mu kamwa gye tuyita palate nti teyakolebwa bulungi, omwana aba tasobola kumira bulungi. Abamu bwe baba bamira ebintu bigenda mu mawuggwe, abamu baba tebasobolerako ddala kumira. Kati oyo mwana agenda n'akonziba ayinza n'okufa kuba abatalya bulungi. Abasinga tubateekamu obuseke bwe tuyita nasogastric tube nga mwe bafunire ekyokulya. Kati okubeera nga tuyambako bano abazadde n'abaana okubeera nti balina obulamu obweyagaza, nti baleme kufa nga tebanatuuka, tulina okubeera nti tubalongoosa. Guno mukisa nnyo kati tuyita buli omu omuzadde bw'oba olina omwana gw'omanyi ku kyalo oba wazaala omwana bw'atyo weetegeke omuleete. Tuyina ne link gye tuyina nti bw'oba oyagala okuregisteringa ogikozesa ne tufuna ebikufaako ne tukukubira n'obeera nti tukutadde ku lukalala lwaffe olwabo abagenda okulongoosebwa. N'ekirala ekituleetera okuba nti twagala okulongoosa bano abaana basekererwa. Abantu babalabanga abantu abaliko ekikolimo nti oba maama we baamuloga n'afuna omwana ng'aliko obulemu nti oba kale kaasi mu luzungu ne babeera nga tebasobola kugenda ku ssomero kusoma bulungi. Abamu bava ku ssomero ne bataddayo ne bava mu ssomero ne babiviirako ddala. Kati tuba twagala nti batandike okwekiririzaamu kuba baba balabika bulungi, basobola okulya, basobola okubeera n'obulamu obweyagaza. Kye kituleetera okuba nti twagala nnyo tubakoleko.
A good evening. So this afternoon we were able, privileged to host Rota Plus International. And this is the Rota Plus means they are Rotarians, but also the team of plastic surgeons who were able to host, including the district governor, Rotary District 9213, Rotary Geoffrey Kitakule, Martin Kitakule. And working with them in partnership with the Kirudu Hospital, the Rotary Club of Sonde, Minister of Health, and the Rota Plus International. So they were last in Uganda in 2024. So this is their second time, and the operation surgery will take place in June. And next year the plan is that we intend to visit in May 2027. The statistics, burns remain definitely one of the common conditions which have, but normally when the burns heal, they heal with contractures, where normally this happens to children, and when this happens, then they are not able to use either that hand or limb, and then this brings disability. But if you look at cleft lip and cleft palate, these are normally congenital abnormality, where a child is born and the palate fails to fuse. The statistics is estimated in Uganda based on statistics which was done in Mulago, that 1 in every 1,000 deliveries there will be a child. And the causes of cleft lip is definitely, some of them are genetic, some of them are nutritional, some of them are because either the mother did not take folic acid during pregnancies. And so it comes with the feeding challenges for the baby, aspiration, repeated respiratory tract infections. So it means that it needs to be closed. If not, then you lose the child dies. So the numbers are quite many. Our plastic surgeons have been working. So this team definitely is able to come and complement what the plastic surgeons want. It's not that this work has not been one, but they come with the team, they come with equipment. And last year when they came, they operated on 74 cases. And it's estimated that to operate those 4 cases using the cost which is attainable in San Francisco, it would mean that they would have spent almost close to $1 billion US. So it means that apart from just having to do the cases, they're also contributing to training. And we are looking at that. This feeds into our fellowship program, where I've told you that in Uganda we have under COSECA, College of Surgeons of East and Central Africa, we have already graduated 13 fellows, specialists, and now we have 16 who are training. There are 5 first year, there are 5 in second year, and then there are 6 in third year. So when those complete, so now our plan is to see how do we strengthen that training so that we can be able to produce more, or so that we can now start having regional teams. So we can have teams. We already have positions of plastic surgeons in the regional referral hospitals. So we need that. If they are recruited, then we need to be able to strengthen and see how those regional teams can be able to have. But normally plastic surgeons don't work alone. So that's why we're looking at how can we have other disciplines, the nurses and anesthesiologists also train so that they can be able to support this aspect. And so we are bringing in partnership. One of the key instruments, not necessarily for cleft lip, but for bigger wounds, like in cancer, in trauma, we need an operating microscope so that you can be able to do microsurgery. You can be able to, instead of you amputating the limb, you can be able to save what? You can be able to save the what? Save the limb. So we are looking at that. Probably we'll work with the ministry, work with the Kirudu, and see that we can be able to get an operating microscope for Kirudu, and so that we can be able to do microsurgery.
Amanya gange nze Geoffrey Martin Kitakule, District Governor, District 9213, tuwano ku Ministry of Health, era nga tuzze wano nga bana Rotary okumiitinga mikwano gyaffe abavudde mu America aba Rotaplast, era nga bano bajja ne bayamba abaana abalina effect ya cleft lips, era nga babajjanjaba. Basooka kujja mu 2024 bajjanjaba abaana nga 77, era kati guno omwaka kampu egenda kubeera ya 7 days mu June mu Kirudu Hospital ng'ejja kuyamba abaana bano. Era tusaba bonna abalina abaana abalina cleft lips bajje bewandiise bapa screening kulaba nti mu June bafuna services zino ezireetebwa Rotary ne Ministry of Health. Omulundi tusuubira okufuna abaana abasukka mu 100, okujjanjaba abaana abasukka mu 100 okubayamba nti kino ekizibu kiggwawo.
Of course. My name is Daniel DeSanto. I am an epidemiologist and I have my master's in public health for development. I am the executive director of Rotoplast International. My motivation for the upcoming camp is we're all lucky enough to be born into a body, but not all of us have bodies that work the same. And for us to really maximize and have a good experience as a human, we're limited by our bodies. And usually the people who are most marginalized, the people who have least access to resources, they have the least health. Issues like cleft lip and palate and major burn scar contractures, that's something that we can do to improve people's existence on this planet. And we only have one. So we band together and we bring volunteer groups in to be able to change people's lives and help them have a more meaningful and happy existence. So that's why we do this. We also have fun doing it and partnering together. Because if you can find someone who you have the same spirit with, and you can change people's lives through that, there's nothing more rewarding.
So how many surgeries do we expect this time around?
So I think that's a very good question, the number of surgeries. We always get that question. I think that the real question is how many lives can we change? Because one surgery changes many lives. If you think about a mother who has a kid who has a cleft lip and a palate, or someone that has a burn scar contracture and they can't shut their mouth for years. You're not only changing the patient's life, you're uplifting the community that surrounds them. You're freeing them from their burn scars, you're freeing them from their condition, but you're freeing the people around them from the stigma as well, and everything else that comes with it. So based on the number of cases that we have and who comes to the clinic, because we have to be adaptable, right? If it's lots of burn patients or patients requiring burn surgery, the number is lower because the procedures take longer. If it's only cleft lip and palate, we aim for about 100 operations.
Okay. So are there plans for long-term engagement in Uganda beyond the camp?
Yes. I think that if it's not a long-term engagement, it does a disservice, or it can do a disservice. A lot of the patients who we see require more than one surgery. So the thing is, if you do one and you leave, where does that leave them? It leaves them needing more. There are patients who need 2, 3, 4, 5 surgeries. Continuity of care is everything, and if we don't come back, and we don't have reliable working partners, we leave them, and that's not what we're about. We want to build capacity, we want to train, we want to develop these fun, lifelong relationships, and we want to do good work, and that requires coming back. So yes, we will be here.
And lastly, what would be the cost of such surgeries abroad?
Oh, so that's a very good question. So, man, plastic surgery, it's not cheap. We did a camp in 2024, and after factoring in the anesthesia, the surgery, all the equipment, the supplies, the physical therapy, everything, that camp that provided 77 people with free reconstructive plastic surgery, when we quantify that, that translates to $900,000, an estimate about $900,000. So, no, total, yeah. So almost $1 million within 7 surgery days, 8 surgery days. So a lot.